Let's talk about sleep supplements,
Oh.
right?
If you want to take it after treatment with me again, great. But let's get off of it for now and let's see what your body's actually doing, because chances are you've been adding a supplement or two or whatnot over time for years, and we don't even know what your body wants to do now. And you actually could be shooting yourself in the foot with some of these things, right? Now, on the contrary, sometimes a patient will come in and will say, oh, I'm taking a beta blocker for blood pressure. Most prescribing doctors who are giving out beta blockers don't realize that there's a significant risk of insomnia when you prescribe these to patients. And I've had some patients who don't need treatment with me at all. They need a 0.5 milligram melatonin pill every night, and that's it. And those are some of the most angry and satisfied patients ever. They have one visit with me, it's done. Melatonin's like the guy at the start of the race, right? He's the guy with the gun. He fires the gun. He doesn't have a car in the race. He's not like helping you stay asleep. He's telling you when to start the thing. So for a lot of adults, taking melatonin is really messing them up.
So what about sleep medications?
The ones that people most often are coming to me saying, I want to quit this. I hate being dependent on this. What do I do? These are going to be the benzos, which doctors are becoming less and less hip to prescribing for sleep. Ambien, the Sonata Lunesta stuff, and then over-the-counter stuff like Benadryl, maybe your occasional Doxepin. And then people are often prescribed Remeron for sleep, and they run into metabolic issues, and they need to get off of it. Most of the time, these physicians have already tried to get their patients to quit and to reduce. But in my opinion, they've tried to do it way, way, way too quickly. And that's because there are physiological dependencies on these drugs and psychological dependencies on these drugs. People come in to see me for treatment. They'll say, oh yeah, so Mondays I do Ambien, Tuesdays I do Trazodone, Wednesdays is Benadryl, because they have it in their head.
Why?
Because they think they don't want to get dependent on one. So they think that by doing a rotating merry-go-round of these things,
that's actually smart. I would have never even thought of that.
Oh, yeah. Well,
sinister.
It's working great.
Yeah.
So I generally work with the doctor and we decide, okay, here's the one you're going to do. Here's the dose you're going to do. And you're going to be consistent with this.
So vodka on Monday and then tequila on Tuesday, red wine on Wednesday, and then Chardonnay Thursday. And this way I'll never become an alcoholic.
Oh, you figured it out, Peter.